pharmacy is centralized medication management of hospitalized patients or inpatients, ensuring that each patient receive the optimal care and medications they need. Means the quantity of the medicine which has been prescribed by the doctor, and appropriately as per the dose the patient is taking the medicines or receiving the medicines from the hospital pharmacy. Whereas in the clinical pharmacy, focus on optimizing patient medication therapy and improving health outcomes, bridging the gap between hospital and the community care. So it is not only restricted into the hospital setting, it is actually bridging the gap between the hospital setting as well as the community setting also. Then for the hospital formulary, hospital pharmacy, the main responsibilities would be preparing and dispensing medications for inpatients, collaborating with healthcare teams to manage drug therapy effectively. Again, I am telling the healthcare team means doctor, nurses, and other associated or the healthcare providers. Then monitoring patient outcomes and the effectiveness of medications, providing drug information and education to the healthcare providers. So it will give the health education not only to the patients, to the healthcare providers also, like doctors, nurses, and it will be done through periodical training, evaluation, and awareness program. And the responsibilities of the clinical pharmacy is also in a large scale. They are conducting comprehensive medication reviews and assessments, developing individualized treatment plans in collaboration with healthcare providers, again with the doctors and the hospital setting and the nurses, monitoring patients for medication efficacy and safely. So after administering the medication, the continuous monitoring of the medication and the efficacy of the medication, whether any reaction is happening or not, whether any kind of post administration problem is happening with the patient or not, that should be monitored in a longer way. Then educating patients. We were talking about educating the healthcare providers. Now we are coming up educating patients about their medications and health conditions, engaging in research and quality improvement initiatives related to pharmacotherapy and pharmacovigilance. So that is the main responsibilities and broad responsibilities of a clinical pharmacy. Next. Next slide, please. So the objective of the clinical pharmacy would be to assist physicians and of course the nurses in doing better job of prescribing and monitoring drug therapy, to assist nurses in administering medications and documentation of medication incidences, like incident report related to medication error, incident report related to any kind of drug mismatch, incident report to any kind of adverse drug reaction. So the documentation and the reporting of any kind of adverse event related to medications is very much necessary. Then to maximize the patient's role in drug use process, suppose I am educating a patient that this particular drug is being administered to you as per the doctor advice. So I have to educate the patient that why the drug is being administered, what is the necessity, what is the risk, benefit, and alternatives, whether any drug reaction chance is there or not. So how the patients will get to know that what medications is being prescribed and given to me, I am getting the right medicine. So maximizing the patient role in drug use process or collaboration with the patient towards their treatment process is very important. Then collaborating with the pharmacy, means hospital pharmacy, to dispense the right medication as per the doctor's advice. Next slide, please. So now the big role is coming of the clinical pharmacist. So who are the clinical pharmacists? Clinical pharmacists' major role would be direct patient care and medication management, again in consultation with the hospital pharmacy, healthcare providers like doctors, nurses, and other paramedical staffs. Then the qualification and the credential of the clinical pharmacist would be either clinical pharmacists typically hold a doctorate in pharmacy or Bachelor of Pharmacy and any other desirable recommended qualifications which will help them to increase their credibility towards become a clinical pharmacist and to have a role of a proper clinical pharmacy practitioner in a hospital. Then certification. Of course, apart from the credential and the degree, some clinical pharmacists obtain certifications such as the Board of Pharmacy Specialties, BPS certification, to demonstrate their expertise in the specific area. Clinical pharmacists will be involved themselves in the biomedical, pharmaceutical, socio-behavioral and clinical sciences, research, clinical research, as well as the quality improvement initiatives and quality improvement project in a particular healthcare setting, as well as the community setting also. Then residency training, many clinical pharmacists complete residency programs to gain specialized training and expertise in the desired field. Next slide, please. Now, the major role of the clinical pharmacist in a hospital setting would be taking the medical history, consulting with the doctors, and see the efficacy of the drug management as well as the purpose of the prescription which is being prescribed to the patient. Then drug information, then rational prescription, through auditing and through surveillance of the prescription documentation, as well as talking to the consultants and the doctor who have prescribed the particular medicine. Then monitoring the patient, as I have already briefed that before providing the medication or before administering the medication and after administering the medication, patient monitoring, continuous patient monitoring, periodical patient monitoring is very important. Then drug reaction and interaction reporting through nurses, through any other who is observing the drug reaction is happening or any kind of interaction is happening or any adverse drug reaction is happening for that particular patient. Then of course the main role of the clinical pharmacist will be clinical research as well as the quality improvement project. Next slide, please. Now, what NABH accredited hospitals practice for managing medications effectively? We can see the NABH 6th edition guidelines. In the NABH guidelines, the chapter 3 denotes the management of medication. So we will talk about, as per our today's session topic, that what could be the role and what could be the ideal role of a clinical pharmacy in an NABH accredited hospital. So NABH talks about medication management, and there are certain parameters based on the guidelines of NABH which tell us that how we have to implement the safe medication practices through which a patient's medication management and the administration of medication will be scientific, and as well as the compliance level of the medication administration and the medication management will take place. Next slide, please. So, what actually the NABH accredited hospital practice for managing medications effectively? The focus of the chapter